There are a number of neurological and neurodevelopmental conditions in children. The most common of these are autism, ADHD, epilepsy, and also cerebral palsy.
Cerebral palsy is a disorder that affects muscle tone, movement, and motor skills. CP usually is caused by brain damage that happens before or during a baby's birth, or during the first 3 to 5 years of a child's life.
Cerebral palsy is an umbrella term used to describe a group of disorders that lead to impairment of the movement and posture control in children, and that is due to damage to a developing brain.
A lot of kids are born with abnormalities and congenital problems, and one of the most common congenital problem that we are dealing with in the field of pediatric neurology is cerebral palsy.
Brain damage also can lead to other health issues, including vision, hearing, and speech problems, and learning disabilities.
It is a non-progressive condition. That is, it doesn't continue to get worse with time. However, the symptoms tend to improve with time and at times get worse.
This is associated with many other disorders that might affect the hearing, the vision, the IQ. It can be associated also with increased risk of seizure, decreased mobility, and heavy burden on the community as well as on the family to help these kids to attain the best of their abilities.
Congenital cerebral palsy results from brain injury during a baby's development in the womb. It is present at birth, although it may not be detected for months. This can be due to infections, maternal health problems, a genetic disorder, or something else that interferes with normal brain development. Rarely, problems during labor and delivery can cause CP.
Ill nourishment of the mother, anemia, some fever due to viral measles, any other viral infections in the mother, okay, not eating good food, or having some kind of problems, genetic causes in the family tree, all these things, trauma, social trauma, psychological trauma to the mother when she is pregnant can all lead to these causes.
As I have stated, this disorder usually has a special attention because the lifespan for this patient is expected to be long, near normal or close to normal. The financial burden on the family as well as in the community is very high, and it's worth looking into more detail what are the causes of the cerebral palsy and if there is any way we can help them to grow and develop better.
Advanced age of the mother could all be a reason. Alcoholism, smoking, which is so rampant everywhere among the mother, alcoholism in the mother, these are all one of the main components, in the etiology. Then during delivery, obstructed labor, presentations, how the child comes out, first the head comes out first, followed by the limbs. In breech, the legs come out first, and when this happens, there will be anoxia, fetal anoxia due to struggle, abnormal presentations. The hand comes out or the leg comes out, child does not come out. So patient has to be, the baby must have to be pulled out. So emergency, urgently everything rushes then. Cord round the neck. What is cord round the neck? Placental cord goes round, winds round the neck, and as the baby struggles and the baby swallows all the amniotic fluid, that is called as swallowing of the amniotic fluid, and in the distress the baby passes the stools and the urine, and that is all gulped down by the baby, and he aspirates, or she, it goes into the lungs. So there is no respiration and no oxygen to the brain, and the brain, certain parts of the brain get damaged. or forceps delivery. Delivery is difficult, they apply forceps and pull the baby out. That can be a cause. Or so many causes are there. Prenatal, perinatal, postnatal means before delivery, during delivery, after delivery.
80 to 75% of the causes of the cerebral palsy are basically due to prenatal causes, which means before the patient was delivered. And these can be divided into two main categories. The first category, genetic abnormality, chromosomal abnormality, abnormality or malformation of the developing brain. And also this is usually happen from the first trimester and affect the patient during the whole pregnancy and after delivery. Now the second category is basically injury to the brain in the third trimester that could be related to, for example, infection, intrauterine infection, or related to placenta fetal blood circulation. Now, in contrary to what is known, the perinatal causes are only causative agent in 10 to 15% of these kids, just like hypoxia or perinatal asphyxia or prematurity. So this is mainly the causes of the cerebral palsy.
When the child is born and cries, that's the normal process that you would expect. But there are a lot of misconceptions among parents. They think that if the baby is born and is patted on the back or is given a lot of stimulation, that leads to cerebral palsy. But that's not true. For cerebral palsy to occur, there has to be a kind of reduced blood supply to the brain, either in the form of a cord around the neck or an obstructed labor, or the difficulties with placenta where the oxygen is not reaching the child's brain. When the child is born and if any stimulation is given to the child or any patting on the back is done to resuscitate the child, that should not cause or does not cause cerebral palsy.
CP may be diagnosed very early in an infant known to be at risk for developing the condition because of premature birth or other health problems.
The severity of the injury or the extent of the injury depends upon how long the oxygen supply has been reduced to the brain and also on where in the brain the injury has occurred.
30% of kids we might not find a reason why do they have a cerebral palsy, and most likely these kids remain a puzzle, but I think with the development of medicine, especially the genetic and chromosomal investigation, down the road we might be able to find what is the reason for these kids to have cerebral palsy. How do I classify cerebral palsy? When I look at the patient, how do I classify the cerebral palsy? We can classify the cerebral palsy in too many different ways, but one of the commonest way is looking at the functional and the motor activity of the patient. There is one called spastic cerebral palsy, which means the tone of the muscle is high, they are stiff and tight, and there's so many subcategories for that. And there is also dyskinetic cerebral palsy, which is they are not necessarily be spastic, but they have abnormal movement like athetosis, and we will talk about that. There is ataxic cerebral palsy, and also there is this common disorder, cerebral palsy, like mixed type. So let's go to the first one, which is the spastic cerebral palsy. The spastic cerebral palsy basically happen in 70% of the kid, and in a simple term, it is basically means that the muscles are stiff, and this can further be divided into according to the anatomical injury or to the side affected of the body into diplegic cerebral palsy, which means my legs are mainly affected with no effect on the upper extremity, if any. Hemiplegic cerebral palsy, which means half of your body is affected, the right side or the left side. And there is a quadriplegic cerebral palsy, which means 4 limbs are affected in your body, and this is probably the most severe, and this is the one that is linked to hypoxic ischemic injury in most of the cases. Now, the diplegic cerebral palsy is classically known to be associated with extreme prematurity. The hemiplegic cerebral palsy basically is classically linked to stroke or abnormality that affect one side of the brain and not the other side, and the prototype for this one is stroke. Now, the dyskinetic or the dyskinetic cerebral palsy is around 10 to 15% of the cerebral palsy. One of the commonest cause of that is what we call subtype is the choreatic apitoid cerebral palsy, which means chorea is rapid jerky movement and athetosis is a slow riding movement. So these kids, they have abnormal movement that could be slow riding movement, or could be rapid jerky movement, more chorea, or it could be a mixture between rapid jerky movement with a slow riding movement. And the third type is ataxic cerebral palsy, which means in a simple term, widely based gait, legs are widely based, and the patient tends to be unstable when they walk. And the least common type is the mixed cerebral palsy type. This is regarding what are the type of the cerebral palsy. Now we will move to how can we help these kids. And I think this topic is the most important topic and the most important message that we want to get to families with patients with cerebral palsy, or even to the caregiver, like pediatrician, GP, or family physicians, or orthopedic physician who deal with these kids. Management. We'll talk about the commonest type, for example, the spastic cerebral palsy. These kids with cerebral palsy are at high risk for secondary to spasticity to develop abnormality in movement and gait, limitation in movement and gait, deformity and abnormality in the joint, fibrosis in the muscle that are spastic, and on top of that, they might have chronic constipation. They could have dislocated hip, because these muscles that stabilize hip joints are spastic, and they can take the joint out of if it is positioned, or abnormality in the spine or the vertebral column, like scoliosis, which is very common in these kids, feeding problem, gastroesophageal reflux, infection, and these usually will need a trained multidisciplinary team to help ensure that all these aspects in a patient with cerebral palsy are being addressed in details.
So by the time a child reaches 5 to 6 years in a normal child, the brain has fully grown. But still, there is a kind of elasticity, adjustability in a disabled brain. So, till 8 years, we early interventionists, neurosurgeons, orthopedic surgeons, gastrointestinal surgeons, medical people, all social workers, we should form a team.
Kids with CP have varying degrees of physical disability. Some have only mild impairment, while others are severely affected.
As you all know, the brain is a very complex organ, and one of the most complex organ in the human body, and different parts of the brain serve different function. I'll just give you an example of the different parts. The first one being the frontal lobe, as we call it, which is in the front of the brain. That controls a person's personality, and it also controls the person's emotion control, and also has gives the child intellectual ability. Then there are other lobes like the occipital lobe, which lies at the back of the brain. That is responsible for vision in a child or in an adult. And any injury that occurs in the occipital lobe can lead to visual problems in the child. The cortex, which is the part of the brain that controls the movements in children or in adults. And this lies basically in majority of the part of the brain, and also the brain is divided into the white matter, which is the middle of the brain, and the gray matter, which is the outside. And all the nerves or the tracks that takes messages from the brain to the rest of the body run through the white matter. So most of the injury that occurs in premature babies, for example, when they have reduced blood supply to the brain, is around this white matter. And therefore, the messages that are passed through these tracks are also not complete. And that leads to difficulties in either their lower limbs or all four limbs, depending upon the extent of the injury.
Cerebral palsy, the name means that it's a palsy that comes from the brain. Cerebrum, a lot of the people might think that the cerebrum is the posterior part of the brain. Actually, the cerebrum is the bilateral hemisphere of the brain. They call them cerebrum, while the posterior part of the brain that control your movement is called cerebellum, and that is the one that causes the ataxic cerebral palsy, while the cerebral palsy in general is the palsy or the disorder of the movement and posture that is coming from the brain, the cerebrum. A lot of the family are very interested into the prognosis for their kids. In general, hemiplegic cerebral palsy, almost most of them will walk by the age of 2, and again this depends on the severity. The diplegic cerebral palsy, 50% would walk by the age of 3, and quadriplegic cerebral palsy, 33% only walk by the age of 3. And again, this depends mainly on the severity of the disease. Now, the main machine of the body is the brain. Your control system is the brain. What controls your heart, your lung, your abdomen, your gastrointestinal tract is your brain. So when the main control station is affected, that will lead to secondary effect on your body. So vision could be affected in kids with cerebral palsy, so they have to be examined for that. Hearing also could be affected by cerebral palsy, and they should be examined for that. As I said, the gastrointestinal tract can be affected, and we want to make sure that they are moving and passing stool very well, to make sure that they are not refluxing and putting food inside the lungs. And also we need to make sure they are getting adequate nutrition from these kids, from what they are taking. Also, because they are immobile and they can't walk, they also might be their bone might be affected, and their bone density might be less than what is normal for their age.
The diagnosis of cerebral palsy mostly at the time of delivery. Even before delivery, the obstetrician during the ultrasound scans and other scans, they are able to pinpoint by enzymatic studies, amniotic fluid aspiration. Now is the science. Now it's time of this period, this science period, where they are opening up a fetus, removing the fetus, correcting the deformities, putting back the child, fetus back into the womb, let it grow. I don't know how many of you are aware of these developments. And then the normal delivery or cesarean is taking place. So after delivery, the assessment is done. How? Like I said, there are some reflexes. Reflexes are of two kinds: mature reflexes, primitive reflexes. As a child is born, the primitive reflexes are there, like a parachute sign and many other signs. When you touch a finger, it clasps, the child clasps. When you take a child and do like this, it will get startled. So all these things are some kind of reflexes, Moro's reflex and other reflexes, which some might appear, some must disappear. If the primitive reflexes don't disappear, it means the brain is not developing. So after delivery also, we keep a track of the child. How is the age responding to the weight? How is the brain growth? How are the reflexes developing into the mature pattern? All these things will warn us that the child is not going in the proper direction.
And now, how to diagnose cerebral palsy? That is a very common issue in diagnosis of cerebral palsy. And also sometimes it could be confusing even to the physician who are taking care of these kids. Cerebral palsy, as I said, it is a disorder of movement and posture to the secondary to injury to the growing brain. Now, most of the time, as a child neurologist, we would like to wait until the age of 1 year or more to diagnose cerebral palsy, and there is a scientific reason behind this concept. Usually in the first few months of life, up to 6 to 9 months of age, the main output coming out from the brain to the muscles is inhibitory, which means like the signal that's coming from the brain inhibit the signal that come from the spinal cord to the muscles. So a lot of the signs and symptoms of cerebral palsy would not be very obvious. So the kid who has severe injury to his brain, and that we know for a fact from his brain MRI that he will develop cerebral palsy, he might not show any signs or symptoms in the early 6 months other than decreased motor activity, persistent of his primitive reflexes, without any evidence of spasticity. But when you follow these kids, you will find out between 6 months to 1 year, in general, they will start to get more spastic, and the signs and symptoms of cerebral palsy will be more obvious. That is why we always would like to wait until the age of 1 year to diagnose cerebral palsy.
For people with more severe cases of CP, all aspects of their physical abilities, and sometimes even mental abilities, can be limited with proper care and attention.